Hello everybody, my name's Emily Wood. I'm a research fellow at the University of Sheffield and I'm very pleased that you've joined me for my presentation today. I'm going to be talking to you about our advanced practice cohort that we have been doing over the last couple of years. This work with nurses in the UK has been funded through the Strategic Research Alliance, which is a partnership between the University of Sheffield and the Royal College of Nursing. And for my background, if you want to know a little bit more about me, I'm a mental health nurse and I have been researching health services since 2011. Over the last couple of years, we have been working on the advanced practice cohort. Advanced practice in the UK is not a protected title, it's poorly defined, and this has led, lack of regulation has led to disparate use of these roles across the UK. So the aim of the cohort is to map the roles of people within advanced nursing practice, to map the cohort's experience, measure their well-being and their attitudes to regulation or lack of regulation as it may be. We recruited from the Royal College of Nursing's list of credentialed AMPs, but this is still fairly small, quite new. So we also recruited from Facebook fora, Twitter, and requested that universities who did the Advanced Practice Masters course also let their students and alumni know. So we had a range of different approaches to recruitment. The little dots on the map, as you can see, we've got people from all over the UK. The dots refer to partial postcodes, partial zip codes, rather than people, so each dot may have more than one nurse associated with it. We sent these nurses questionnaires, and they were asking about their workplace, their role, their well-being, and a selection of questions from the NHS Staff Survey, which goes out every year. We're not entirely sure how many AMPs, advanced nurse practitioners, there are in the UK because it's not regulated and the term is used so differently in places. So it's difficult to know what a good sample size is, and that's why we went for such a broad range of different recruitment methods to try and get a broad range of people as possible. So we've now got almost 250 people on the cohort, and despite the fact that everybody was working within the UK healthcare system, there was a large range in pay and conditions across the cohort. All participants identified as advanced practice nurses. However, there were 45 different job titles across people who joined the cohort, and they were split across 5 pay bands. For our international audience who may not be familiar with Agenda for Change, this is a standardised pay banding for non-medical healthcare professionals here in the UK. The idea behind its introduction was that people doing the same work, the same level of responsibility, would be paid the same and have the same career progression, regardless of what part of the country, what branch of healthcare and what organisation they worked for. So we tried to standardise things a little bit. So for example, a newly qualified staff nurse is usually a band 5, ward managers are usually a band 7. It tends to be about the same wherever you go. So to have such a broad range here as we do, with people who have got the job title advanced nurse practitioner or advanced clinical practitioner, and yet to be across 5 pay bands, was quite dramatically surprising. It shows that what is understood by advanced practice in the UK is dramatically different in different parts of the country. And then we have the 4 pillars of advanced practice: clinical research, teaching and leadership. Almost everybody had a direct clinical role, although for some of the most senior managers that was quite limited. 80% agreed that they had leadership role within their job. 82% had a teaching role, but only 55% actually reported any involvement in undertaking research. And some interviews that we did after the questionnaires revealed that the nurses that we have recruited strongly agree that they should be doing all 4 pillars, but few are given any protected time away from clinical practice to engage in evaluation and research. And even fewer still felt that they actually had the confidence and the skills needed to undertake a piece of research. So these questions related to some of the NHS Staff Survey questions that we asked. Now, the Staff Survey goes out to all a large selection of NHS staff every year. We incorporated some of the questions with permission within our survey so that we could compare our cohort to the national trends. And what we found was that there were some fairly large differences between advanced practitioners and nurses in general across the NHS and workforce in general across the NHS. We've just highlighted some of these differences here. These are not necessarily statistically significant differences. The national findings for the NHS Staff Survey don't release standard deviations, so we weren't able to do any statistical tests on these, but we highlighted them as quite large differences. So the advanced practitioners tend to be more satisfied with the quality of care they're able to deliver. They seem to be more motivated at work, but they also reported feeling unwell as a result of work-related stress within the last 12 months. The last 12 months for this was for going backwards from February 2020, so this was before there were any COVID cases in the UK. But then, of course, COVID has changed everything. We had done 2 years of the cohort before March 2020, which is when the crisis really struck the UK. And although we'd finished the second year of our annual survey, we were very concerned by some of the reports in the media, and I'm sure headlines like this have appeared in local to you, whether that's in the UK or in other countries. And I'm sure, like us, you know, quite concerned about how we could try and support frontline healthcare staff and how we could see what was happening for them. So we sent an additional survey out in June 2020. It was sent to everybody on the cohort. We got a response rate of 51%, which normally you wouldn't think was very good, but actually given who we were sending this survey to and under what circumstances they were currently working, we were actually quite pleased with 51%. And the respondents that we did have, the majority of them reported shortages in personal protective equipment and reported shortages in staffing. Many of them had safety concerns, and these were twofold. There were their own safety and the safety of their family, but then there was also safety concerns for their patients. Things like clinical risk of trying to evaluate primary care patients over the phone. When you have very little clinical information, you can't take somebody's blood pressure if they're on the other end of a phone. So trying to make decisions without the usual level of information that people had. But they also said that there were some innovative practices, and people reported that they thought this might be advanced nurse practices' time to shine, that they could show exactly what it was they were capable of and that they could things that they could do. So there were some positives. There were people reported that their department had put in place some innovative measures, that things had changed, and that some of these things were thought to be changes for the better. So there were some positives that came out of it, but safety came across as a really big concern, unsurprisingly, but was something that we felt probably needs to be continually monitored as we go forward. So, to our knowledge, this is the first attempt to understand the working environment and experiences of advanced nurses in the NHS. This has been difficult in the past because we don't actually know how many there are because of the disparate and non-regulated way that people are in this grade are used. And this disparate use is still around and probably we think needs addressing. The 4 pillars of advanced practice are not equally valued by employers, but are valued by advanced practitioners themselves. And the effects of the COVID crisis on all staff, but particularly advanced nurses, needs to be carefully monitored. Advanced nurses have huge depth of skill and experience, and these are staff that we do not want to lose. So making sure that they are well supported is going to be hugely important in the coming year. We have future plans for the cohort. It was always planned to be a 4-year study. We've done 2 years, so we have another 2 to go. 2 of those, as I said, were completed pre-COVID, and 2 will be completed, I keep saying post-COVID, hopefully post-COVID. The next one is in February 2021. We can also make additions to the annual survey, and we're thinking about doing that, as I said, to look at people's well-being and how well they're being supported. We can also conduct qualitative investigations to dig deeper into some of the key issues. We decided not to do that this year, as we'd already done the extra survey, and we didn't want to add to the burden of already overworked staff, but we do plan to do more qualitative work in the future. And finally, I just want to say thank you to all of my colleagues at the Strategic Research Alliance, and thank you to you for listening to my presentation. This has been a very whistle-stop tour of quite a large project, so if you would like to know more about our work, please do visit our website or tweet or email us. And our first journal paper about the cohort is in the Journal of Nursing Management. Please do feel free to access it. It is open access. And we have another 2 papers hopefully coming out by the end of the year, so please do keep an eye out for those as well. Thank you very much for listening.